On. Good. Hey guys, we're doing our skin needling demo tonight. We have the lovely Shawnee B.
Good evening.
So the reason it's going to be a little bit backwards and forwards because we're in actually the treatment room, so it's about the only way we can do it. So Danny will be going, who's behind the camera, we're going backwards and forwards to myself, Nina, who's having the treatment done, and back to Shawn. So I wanted to do the treatment live for you guys tonight. I feel really honoured that Shawn's actually going to be, here with us. Shawn is an expert in skin needling in the industry, and his company,
Clinic Solutions,
are leading the way in dermal needling, the pens and the equipment that go with it. Shawn's taken it up another level, and they actually do the PRP and Factor 4. Factor 4. We don't do that here at Refresh. It's an amazing treatment. We can talk more about that another day. You can come and we can just talk about
Absolutely,
that.
Yeah.
So, but tonight we're going to be talking about the skin needling. So I've actually just prepped Nina. So we may as well just get into the actual needling. So the reason I want you to watch the skin needling, so Nina's had her numbing cream on, and we're just going to get straight into the... I'm just wondering, Shawn, if you can maybe come and sit around this side. Would that be easier, Danny?
Yeah.
What do you reckon? I'll move out the way.
Yeah, that's good to know.
Yeah. Sorry, guys. We're shifting around. And at least we can then talk at the same time, eh? What do you reckon? Is that easier, Dan?
Much better idea.
That's perfect.
All right. So, talk to me about the M-derma
The M-derma.
head. So we're gonna get the M-derma head in. So.
The tip's really important. The technology of the tip has really changed the way we skin needle, and the reasons being is there are what we call O-rings in the tip, and those O-rings expand when they go into the device. And a couple of things happen. They expand when they go into the device. When you've got them in the device and on the skin, and you're using a cosmeceutical or you're using Factor 4, which is a serum that you get from the blood, it doesn't go back into the tip, and it doesn't go into the device. Yeah, so it's just really, really nice. It's another safety mechanism, and it also prevents cross-contamination as well. Another nice thing about the tip is it's got a scalloped edge, and that scalloped edge makes the gliding of the skin very, very easy. It creates little wind channels as well, so it creates like a bit of a vacuum, if you like, to go across the skin, and it's just easy to use. It doesn't stop, doesn't stagger, as you've known yourself, Jack.
Absolutely.
It just works really, really well.
And I don't get as much grazing with this pen.
No, because it does glide much better. And also too, obviously keeping something on the skin in terms of a slip, it makes it much better as well. So there are two O-rings in the tip. Once the tip goes in and you twist it around, when you actually twist it back to zero and pop it out, you can't reuse it, which is a really good safety mechanism as well. So it's a one-time use only. The technology is crafted very, very well, and it's got a 3-year patent on it. So it can't be copied, which is really important too.
So a lot of people are really familiar with Derma Pen.
Yes.
Okay, so
I launched Derma Pen.
There you go, guys.
So
Shawnee actually launched Derma Pen.
I launched Derma Pen some years ago, and it was a great piece of technology.
But this is greater.
And it's still there, but what we've got now is we've got the M-derma, which comes from the manufacturers of Derma Pen America. So there's two Derma Pens.
So guys, why would they manufacture the same pen and call it a different name without going up a few levels, or 50 in this case?
Literally, we've gone from a Toyota to a BMW.
There you go. Okay, so shall we just start, because we've taken the numbing cream off?
Yep, so put some...
So look guys, I just want to share with you, I don't often get the chance to catch up with Shawn, and he's been so busy really launching M-derma really, and it's taken off massively. Yeah. So I've actually had the chance to sit down and talk with Shawn just this evening, just before we've started here, and there's some with the skin industry. I don't like to say beauty, because I don't think we sit in the beauty, especially using equipment like this. So in the skin industry, there's constant changes. So what we were told literally 2 months ago can change. It's as quick as that with the new information that comes out. So Shawn's actually just had a quick chat with me, and we possibly could be changing the way we do things here at Refresh as well after talking to Shawn. However, we are really aware that we have a different clientele to the top end of what this pen can actually do, and that's where factor 4 comes into it.
And I have to say to you as well, Jack, we don't sell the device to beauty therapists, so we only sell it to dermal therapists or cosmeceuticals, and that'd be plastic surgeons, cosmetic surgeons who have a skin range of practitioners in their practice. So this is...
You're not going to get this in a beauty salon.
No, it's a high-end device, and it's a lot more expensive than other devices, but you get what you pay for. And,
absolutely.
And you know how well this works.
Well, my clients know how well it works. So, Sean, what would you like me to start on?
0.5.
Like me to start on 0.5?
Yeah, so everything on the skin, on the body has different variations of thickness, and particularly on the frontalis, which is the area that Jackie's applying the HA to now. It's a very thin area of skin. There's not much meat there, so I always treat this area first and start at 0.5.
I've actually ended up going, when I do a needling treatment, I've ended up going, because this can be a more painful area. And when I say painful, when you're using a good numbing cream, it's not too intense. As long as you're following the procedures and the time-wise. Then I'll do the nose, then I'll do the lip, and then I'll go on to the areas that really you don't feel anything.
So we do it slightly differently?
Yes,
and
absolutely.
Again, and there's no wrong way or right way.
There's not, and that's what we were saying about the industry. There's so many different things that we're getting told, but however, we don't want to just stick with something just because it's what we were told, which is why I've asked Sean to come back and sit and talk to me more about the new developments that are coming through.
Yeah.
And I may as well grab him while I can. He's now a new Queensland local.
Yeah, Queenslander.
And Sean's, he's got some really exciting news. I actually can't say it on here. I nearly did.
No. But start on 0.5 on the forehead. And also too, the nice thing with the cradle, which you can probably see just here in my hand, is that you've got 5 numbers on there, 1 to 5. When you're on number 1, you're on 70 hertz. So we have the ability of how much power we're putting through the device from the cradle, which is something we haven't had before. On other pens, we have the power in the pen itself. So I do a couple of passes on number 5 to make sure that we're getting the correct clinical endpoints, erythema and petechiae.
And we've got some petechiae there. So do you want to explain can you see the little blood spots there? Do you want to explain petechiae to us, John?
Petechiae is what we call, it's a terminology we have in the industry for spot bleeding, and what that basically means is that when we're seeing petechiae, it really means that we're in the correct dermis. And there are lots of different layers to the dermis, but really the structure that we're hitting here now is what we call the reticular dermis, which is the deepest parts of the dermis, which we want to get into. And then once we get that blood that we see, or that petechiae or spot bleeding, we're getting the ability to release the fibroblasts. And that's what creates the ability.
That's our collagen, guys.
Yeah.
So I probably did this a lot different than Sean did. He said he goes a couple of passes over, and when he means a pass, he means twice in the one area.
Yeah.
Now I just go and do some little circular rotations just to make sure I haven't missed any areas there. But just,
Again, technique-wise, there's so many different ways.
There's no right and wrong. It's getting the area.
Yeah.
See, there's a double pass there. So.
And you can see the patient, she's in a coma just about.
Can you feel that at all, Nate?
I can feel it. It doesn't hurt.
So what does it feel like?
Just a movement over it, I guess. I can feel it in my hairline.
Yeah, you will feel you've got more nerve endings with a hair up in the hairline. So you've got more nerve endings coming up at the bottom of the hair root. Sean, I just wanted to, I've actually lost my train of thought there.
I was going to say, you can also hear how quiet the device is.
Oh, that's what I was about to talk about, the device. Okay, now, yes, it's quiet, but I've actually got quite a vibration in my hands. Nothing overly. So I can feel that it's really... I told you it'd be fun, guys.
She slides off the bed.
So, guys, the reason I'm pointing out that vibration was not to tell you that I've got a vibrator in my hand. However, it's going so fast. Now, a lot of the needling pens don't rotate this speed, which means you are getting micro trauma, micro insertion points. How many more are you getting from the normal pens?
Well, every pen's different. I don't want to go into how many they do.
We're going to be nice with the other companies.
From our point of view, when we've got the device on number 5, which is 110 hertz, we're putting 96,000 holes, micro holes, into the epidermis or dermis in 1 minute.
96,000 in 1 minute.
1,600 holes per second. That's a lot of holes.
That's a lot of holes.
So it's good. So it's a really good penetration that we're getting right into the area of the skin.
I was going to say something, then I'm not going to say
No,
a word.
don't. Because you're holding the vibrator as well.
It had to do with the vibrator.
Yeah.
So guys, for me, it was really important. Obviously I was using another needling pen prior to this device, and I felt privileged that Sean felt that his machine, his pen, was in safe hands of having us use it here at Refresh. Like he said, it's not going to be in your average beauty salons.
Not at all.
The one thing I noticed mostly, Nina, so do you want to explain what it feels like on the nose?
Tickling. It's like a feather.
Yeah, so...
And also too, the nose is a really difficult area to treat because our noses, most of us have got very different shaped noses. Some noses are a bit more spongy, some have got a bit more tissue on them, some have got a bit more of a, you know, what I call a ski hump or a ski ramp. But also too is cartilage under there as well. So it's also kind of, can almost feel a little bit hard sometimes. And moving from the nose, what's really exciting about this tip is that you can go right up to the eyelash.
Whereas they say don't do that.
Absolutely.
So it used to astound me that a lot of people, I would see them on Facebook or on wherever the videos are, and they'd have these big white raccoon. I'd be like, I don't know, I'm in my 40s, like, sort that shit out up there. Like.
Well, one of two things are going on. We're obviously going right up to the eye line, which we can get nice and close to the eyes, but we're also having an eye orgasm. So I think at the same time, we're getting two benefits from the one device. It's a good thing. It's a good thing.
And look, it really is quite a weird sensation, the vibrating feeling up around the eye. Some people sneeze. I have a couple of clients that go, put their hand up, and that's my signal to take it away because they're going to sneeze.
Yeah. Absolutely.
So guys, have you got any questions for us? Has anyone got any questions?
Don't be shy.
No questions yet. But Brenda says it's nice to see another session from Refresh. Brenda
You're
Gasson.
welcome, Brenda. Look, we just want to bring you real, live, no bullshit skincare. Like I said, we're not a beauty salon. We're not a cosmetic surgery clinic. We're results-driven skincare treatments. We sit in the middle. We sit in the middle of going to see
But that's good though.
your high-end places, and then just your facials. And like Sean and I were talking about before, we all know, guys, that those beautiful, relaxing facials do nothing that a glass of wine can't do.
Well,
A bottle of wine.
But the thing about the industry, and this is what's really important to note, is that the industry is big. There's a lot of space for everyone to play in. So, you know, what we've got here is the ability to treat the skin in many, many different ways, using many different apparatuses and devices, but also too cosmeceuticals. And creams are changing all the time. They're becoming more active. They're penetrating deeper. We're getting better results. When you put a cream on...
We're going to turn it up a bit.
We can, yep.
We're just getting into some more tissue area. So
anything under the eye, I think you can go a little bit deeper, and the skin's thicker, and she can handle it.
And Neen's actually got some post-problematic skin here on her cheeks. So we're going to crank it up when we get to that area too.
I think she looks great for a 70-year-old, don't you?
I've got a question from Sandy. She wants to know what the downtime is.
Good question, Sandy. Everyone's different, so we can't say that everyone's going to be the same. But Sandy, generally after a skin needling like this tonight, the patient will go home. They'll be red. We would suggest that they don't do anything for their skin tonight, but tomorrow morning get up, have a shower in warm water, not hot water. Wash your skin, cleanse, apply your makeup, do all those things, and carry on as normal.
So you can actually go deeper. But you have to allow for the downtime of it, guys. So if you are going to really want to work on some acne pit scars or some deep furrowing, you are going to need to crank it up a little bit. Your downtime's going to extend each time.
Yeah. I mean, it's very difficult to say what's the average because everyone's different, but I always say somewhere between 12 and 24 hours of redness. But you've got the ability to be able to wear a mineral-based makeup, So if you can wear that, so if you can keep the skin naked for the rest of the night,
and
go home and have a glass of wine and relax.
Yeah, and look, really, we do not want you to be putting stuff on after a skin treatment.
No.
And you definitely can't be using a mineral-based, any kind of makeup after you've done a needling unless it's mineral.
Yeah.
Why would you saturate the skin with...
But Jack, what's really important too is that the holes that we're creating on the surface here on the skin, those micro holes that we're creating, they close over within 2 to 5 minutes. So they're not left open, which is really, really good. But the healing process begins underneath. and that's a process that takes time.
So Sean, why is needling? I mean, I can only talk from my own experience, and like you, I wouldn't have imported the same caliber of machines that you've imported in the past. Sean used to import the greatest laser machine that we have.
Yep.
The Rolls-Royce of laser machines.
Luminous, yep.
Luminous. So what I've seen in skin needling results to what we used to get with laser, skin, I can't even think of the word of it now.
Resurfacing?
Yes, no. Skin tightening, radio frequency.
Yeah.
This is way surpassing it.
Well, you've got to, again, I think we need to be subjective at how we talk about this. There are lots
of course, they're doing different things.
There are lots of different things
as
out
an overall,
there. Yeah, there are lots of different things out there for skin. What has changed over the years is that we've gone from using fractionated lasers where they did a great job, but the downtime is 4 to 6 weeks. We had CO2 lasers. It looked like someone had been through a 3rd-degree fire, and they couldn't go outside for 3 months unless they wore a bag over their head. They couldn't go in the sun.
I'll never forget when I saw a lady at Priceline. I nearly had a heart attack.
At Priceline.
She was in line. She was in line.
That's the problem to begin with.
She had pus.
Yeah.
Coming down the side of her face, and she'd actually had laser done the week before, and I was like, you need to get to the hospital now.
Absolutely.
It was infected.
Yeah. Look, I'm a big believer of lasers. I think lasers are fantastic. I think they have a great place in the marketplace, but what I do believe more now is that skin needling is effective, it's cost effective. But the most important thing is that we all want to have limited downtime. We don't want to be sitting around for a day or having to have a week off work. We can't go outside, we can't see our friends, running the risk of infection, all these other things.
However, in saying that, if you've got a client, which I do have a few of them, they're more than happy to take 3-4 days.
Yeah, and you've got those clients that will do that.
You can crank it up with the skin needling and really get some amazing results. But I also have those clients who go, I don't care if I come for the rest of my life and have skin needling. I just need to be able to go out in public tomorrow. I've got to work. So
I've got to this process now in the sport pattern, as a 50-year-old man, I've been skin needling now for over 12 years. I think skin needling has a real place for everybody every day. You can do home care, which I'm not a great fan of. I think you need to come into a practice like this and have it done properly and professionally. I think, a series of skin needling treatments.
So hang on a second, we'll just go back there again. Are you talking about the home rollers?
Yeah, home rollers.
So what you can actually get a home roller. So you would have to literally sit there and roll your skin all night to be able to get $96,000 perforations.
Yes.
Like seriously.
But you can't go that deep because you need to use obviously topical anaesthesia.
And you're not going to have access to that anaesthesia.
But how I see that though, Jack, is that what you're doing here with skin needling and then having someone go home with good skincare is going to keep that process of the skin, feeding the skin, making the skin better.
Which is why here at Refresh we've kept the prices at a point where you literally cannot say no to the skincare routine, because that's why we've done it at that. Because to me, if you're not using a cosmeceutical skincare brand, you're just not going to get the permanent results. No. You're just not going to get them.
And look, at the end of the day, as we get older, we need to do what I call a cross-fertilisation of treatments, and that could be skin needling and using vitamin-infused products, and obviously using more active vitamin A's and your antioxidants with products like vitamin C in them and so forth. But also too, people are still doing their Botox and their fillers and everything else. So we're doing bits and pieces to add to the shopping cart of what we do for our skin treatments.
So I'm just coming and having another just quick look. I actually wouldn't mind going a little bit closer to the lip there.
And what you can also do, which we haven't done, but you can actually
at the top of the eye,
anaesthesia and do the top of the eye.
I think we did pop some anaesthetic on there.
Skin.
There you go.
I do the Shawnee B stamping technique on that area.
Do you? So what's that?
So just hold the device and just
leave it on there.
Yeah. Can I just show you something? Just quickly?
Absolutely.
So very, very just with a little 10% overlap and stamp and stamp and stamp. And all we're doing now is going down nice and deep into the reticular dermis. And for those women that get those lines there, because they talk too much.
There you go, guys.
There's there you go.
So that is a little bit discomfort, but I don't think I put the numbing cream down as far as what we're going down here on there.
What I would do though, Jack, is I would usually turn it up a little bit higher in terms of going depth. So we're going into the reticular dermis, getting a nice penetration.
So turning this up higher or that up higher?
Turning that down.
Okay.
So we're going deeper do a couple of passes deep, then wind it back and go shallow
And
into
go
the
over it.
papillodermis.
Okay, all right then.
So there's different things that we can do to get different outcomes for different areas of the
And
skin.
it has changed, like I said, like when we first started needling, like we weren't getting this information fed through. This is stuff that we're learning. The industry, the knowledge, the science, and how deeply we can work with the skin now is so superseding itself all the time. Like you really need to make sure that you're not going somewhere where they learn something and that's it.
It changes.
It's changing, like constantly.
One of the things I have to mention of with regards to this treatment that we're getting with the M-derma is the overall and the consistency of erythema.
Absolutely.
Which I see coming through.
So erythema
time
is
again.
the redness, guys. Yeah. Erythema is the reddening of the skin, and oedema is the swelling. So one thing that I didn't used to get with our old pen was I can't even think of the word, consistent. Yep. It's consistently red all over, which means we are causing trauma on an even keel. It's all over. It's happening all over. It's totally consistent.
The other thing is too that it has been said to me a lot. Stamp that area.
You
so just lift the eyebrow up and now stamp it. There you go. Get into that tissue. And while we're doing that is we're retracting that, what we call, well, not that you've got that, but you know, if you have got saggy or loose skin above the eye, this is a nice way of
I'm so glad I got
skin
you
tightening.
in, because honestly,
This is it's called the Shawnee Bee stamping technique.
the Shawnee Bee
Not
stamping
drizzle.
technique.
But the other
Any questions, guys? Come on, you've got like the bloody leader of this. No, he's so knowledgeable on skin needling. Ask now or forever hold your wrinkles.
What I was going to say is I get told all the time that, you know, when you do the frontalis, for example, on a lot of devices they have to get it to 1 mil to get redness or erythema. Now we only had it on 0.5.
Absolutely,
so,
look.
and the redness is still there, which is what we want. We've got what we call a clinical endpoint.
How you going, Nain?
Those bruises are fantastic. Bruises are a girl's best friend.
Any questions, guys? None?
None yet.
You're nuts. He's going to be gone soon.
Send Jack an email.
Nope, I'm not answering. They've had their chance.
And what you could do, Jack, is just come into the eye area just a bit more.
And stamp that a bit more.
Just put it on 0.5. Pull the tissue down.
I'll come back down.
Yeah, pull that tissue down. There you go. And just very gently stamp into the eye area. Yeah. Yeah, that's the way. And again, what we're doing here is we're getting a retraction of that tissue. So how you see we often get cracky eyes. I love stamping. Love it.
Yeah, absolutely.
So for pitting scars and
so
things like
there's
acne,
also different, they call them stamping machines. Now that is not what we're doing now.
No, this is just a technique.
This is a technique.
Yeah.
So
the Shawnee Bee
stamping
technique.
needling pens are not what we're doing now.
No, not at all.
Not even close.
Not even close. And if we could be so bold, is to show...
Go on, Sean. You know you can.
Okay, if we can turn it up to 1.75 and place it on Nina's cheek, and just do a couple of stamps, just to show everybody what we get in terms of the trauma that we create on that really thick part of the... Yeah, and just do a couple of... you'll be okay.
Oh, no, the cheeks are fine.
Right, and just stamp it. Yep. And you can hear how we're going down there. You can see the reaction that we're getting straight away. So if that tissue underneath was scarred by scarring from acne or chickenpox, I would go nice and deep like this.
We're giving away our bloody secrets here, Sean.
Well, we want good skin, but this is breaking up that
You're not going to get it without this pen, guys, though. You are not going to get it without this pen. You must ask if your salon uses M-derma. That's the word that you need to ask for. I'm not joking you. M-derma is what you're asking for. If they don't have M-derma, you're not cutting it.
Or go onto our website, which is Clinic
Solutions. And find
Solutions.
out what salons, Clinic Solutions.
With a K, Clinic with a K, clinicsolutions.com. Yeah, see the reaction that we're getting? So this is a really good technique to be able to use when we're breaking up tissue underneath that's really fibrotic from scarring.
So fibrotic, what we mean...
Say, what's fibrotic?
So fibrotic is like the thickening. It's scar tissue.
Scar tissue. And so now we want to even her up.
Nah. We're going to go for the pirate look.
Put a Z on this side.
She's getting married, so we might put his initials, hey?
I just say Shawnee Bee was here.
So we've got another question. Does the treatment include the neck?
Yeah, well, we can...
We can. So we've actually just... Sean, block your ears, because he thinks Actually, Sean's exact words with my prices were, I'm bastardising the industry. And I'm bastardising the neck and chest in this industry as well. So $79, we're doing upgrades for our neck and chest on our needling now.
Wow.
It's ridiculous.
Wow.
Like, it's, wow.
Wow.
He's not happy.
No.
He's not happy.
Look.
Look, we're catering to a different market.
Yeah. You've got a different business model.
We've got a different business model. I'm really clear about my business model and what I'm wanting to create with Refresh. So we're not a Sweaty Betty clinic, as we're using the #1 pen in the world.
Absolutely.
We work with awesome products. It's just that I have it. I'll hit you later on. You get your skin needling.
I'll hit you later on.
But yeah, so.
What was the
question?
We have the ability.
Does it include the neck?
We can treat.
No, it doesn't. But you can include the neck and chest for $79.
For an extra cost. Yeah.
And we also can do the back of the hands, ladies. So the back of the hands are really...
They're special upgrades that we have too.
Oh, there you go. And they're $59 probably. I don't know. But the back of the hands are a great area to treat with this device because we're able to thicken the skin and de-age the hands.
You're going, they had enough.
Sorry, you look great. You look hot.
Any questions? We're going to be wrapping soon. I'm just going to be rubbing this in a little bit.
Yeah, get all that good stuff in.
We've got 4 minutes.
We've got 4 minutes. Any more questions, guys? Any more? This is your time. Sean, can you think of anything else? Because this video stays on our Facebook site that you want people to know about skin needling.
Yeah, look, I think, if you haven't had skin needling done before, start doing it. Do a series of 4 to 6 treatments and start doing it annually. Rather than getting to a point in your life cycle of going, oh, I'm looking so good now, start preventing it now. Yeah, it's not anti-aging, it's preventative aging. It's positive, be the best you can be.
Absolutely. Like, seriously, guys, like Sean and I were both saying before, our actual skin is getting better. Sure, we still get some wrinkles and stuff like that. We're still moving and talking.
But I think what's really important is that our skin's getting better as we get older because we understand it.
Absolutely. Absolutely.
A couple more questions.
Yeah.
First one, is this treatment more effective than PDT?
Very, very different.
Very
no comparison.
different. No comparison.
No comparison. So PDT is something that's done very, very differently and more often not used for treating skin cancers and other various skin disorders. This is more of a, for want of a better word, a cosmetic treatment. So very different.
Yeah,
absolutely.
Good question, though. Great question.
And another one, can I have Botox 3 days after?
No. You need to wait 2 weeks pre or post any skin needling treatment. That would be our recommendation. Wherever you're going to... I think
it's across the board pretty much.
Yeah, wherever you go, check with a practitioner or nurse, but I would recommend 2 weeks
just
pre or post.
Just because you can shift and stuff like that and stimulate, move it out the way and...
Absolutely right. That's it. Now,
actually, I'm just going to pop... Can you pass that replenishing mask, that first tall tube there?
That
behind.
That
no,
one?
that one. Can you squirt some of that into my hand?
Squirt whatever you like.
I was waiting for it. I was like, where? Yeah.
This might be a new tube. Is it coming out? Yeah.
It's coming out, all right?
Shush!
It's flowing. You're asking the wrong man that
I
question.
knew this was going to be like this, guys. It's Refresh, hey.
It's refreshing.
It's refreshing. It's the no bullshit approach, hey.
Exactly.
Any other questions? You said there was another one there.
We've got a minute and a half.
You got a minute and a half. And
Yeah.
guys, you can, like Sean said, you can ask anything else. Anything else you want to leave them with.
What I wanted to say is that a lot of practices that you go to, they will actually do the treatment and you'll see the blood on the skin and they will actually clean it and wipe it away.
I was actually taught to do that.
And I'm not a believer of that. And why I'm saying that, because
Absolutely.
everything that we're getting coming to the surface of the skin, we want to push back in and then seal it on top.
Because you've got plasma and everything coming up there
you've
too.
got cytokines and growth factors and your stem
It
cells.
makes so much sense. That's why I said to you tonight, guys. I love that Sean's come in and because I've learnt something again. So we must keep up with the industry. A lot of therapists, and I used to own a skin college. They go to college and they never go back and study.
No.
They never go back and study again.
You got to keep learning and evolving and reading and there's no right way, there's no wrong way. There's just lots of different ways that we can merge to do it. So, well done, great treatment. How do you feel?
Great.
Yeah. Out of 1 to 10.
Do you want to tell anyone anything then that you've noticed from having your skin needling?
I use a lot less makeup. Sits a lot smoother.
Good.
That's
Your skin's getting better, getting healthier. Healthier
Absolutely.
skin.
Stronger.
Tones change, textures change.
Definitely.
Texture, definitely.
Yeah, it's the most important thing.
Absolutely.
Awesome.
Alrighty, guys. We're signing off. Ciao.
Thanks, guys. See ya. Ciao.